Vince here in my home office because my wife's on vacation and my 17-year-old dog can no longer use the dog door. Um, that's what happens when we get old. And of course, Dr. Patino in his office just returning from a trip himself. And tonight we're going to be continue our discussing about toxic masculinity, and in particular, a terminal effect potentially, or at least the decision that could be made by somebody who is experiencing such feelings that is terminal, and that is toxic masculinity and suicide. How, doctor, are those two things specifically related?
Welcome, Vince. I'm glad to be back. I was gone for the last 4 days. Um, I mean, that question is very deep, in terms of
That's my job.
how, how does toxic masculinity and suicide relate to each other? And we kind of given some hints of that over the last few programs that we've had, kind of focusing on masculinity. But when I was gone, I mean, one of my best pastimes is just read. I find stuff to read, stuff gets sent to me. And I think I sent you an article about
You did.
toxic masculinity and suicide in veterans, in particular, in some places of the United States. And I just wanted to make sure that we had some. Let me turn this off here. So we had some idea of what is happening in some parts of the United States and how it's being looked at,
Hmm.
right? So, when you go ahead.
Well, no, I was just saying, I think my understanding of why so many men, and you've mentioned this before, so many men are much more successful at suicide. And again, I personally have known six people who have taken their own lives, and a few of them did have what I would consider to be some of that toxic masculinity. It was more, I'd rather be dead, I'd rather fall on my sword than be taken, or more importantly, I'd rather fall on my sword than ever be seen as vulnerable or fragile or human, really.
Well, in big part, I think it has to do with the idea that man has trouble expressing emotions, and in some circles, the expressing emotion becomes almost, um, how can I say it, um, shameful, and shameful to the point that you have to protect your manhood and your masculinity to an extreme, right? Rather than expressing your emotions to somebody who's close to you. When your masculinity has risen to the level of being toxic, then it becomes very problematic in terms of you not being close to anybody, right? Which is at the end almost the pathology that we see with um, narcissism, if you may.
How is that? What do you mean by the pathology of narcissism as it equates to masculinity?
Well, toxic masculinity and narcissism go kind of hand in hand, right? Um, so we have to remember that it's not unusual that when we talk about people who are narcissistic, they tend to be very self centered. They tend to be very, to some degree, aggressive, right? And they tend to exercise power by shaming other people. That doesn't mean that everybody who's toxic in their masculinity are narcissists, but they share a lot of features. And some of those features in particular that we find in both sides is emptiness. Is a person that feels so empty and so lonely that has to reflect an image to the rest of the world of being in control. Excuse
Hmm.
me 1 second. I'm gonna have to change my ear pods because I am getting an echo. Okay, just give me a second.
Of course.
Can you hear me okay?
I can hear you just fine. Is that better?
That's much better. I think my I had a issue with the microphone going on. So,
Quick question then, because a couple of years ago we had this president that seemed very narcissistic, and I found it very odd, personally, that because of his behaviors, like I said, being aggressive and this, people would describe him as very masculine. And as a person, again, my personal opinion was the guy's got fake hair, comb over, spray tan, and wears a girdle, and tries everything he can to do to look masculine. To me, that's the antithesis of it. I mean, all the dangerous, tough people I know don't have to tell you that they're tough and dangerous. It seems like that person was making such an incredible effort, but not so much the effort to be masculine. It's the I think people perceived him that way because of the narcissistic tendencies.
well, absolutely. I mean, I've never had the privilege of evaluating any president, right? Let alone the most recent past president. But you can say that a lot of the behaviors that you're describing can be described in the narcissistic realm, right? I mean, obviously, we're not in the business of making diagnoses on people we have never evaluated. Okay, so all of that said, I think that it's important to remember that what you describe is a beautiful caricature of somebody pretending to be tough. Because in reality, people who are tough don't have to show it, right?
Yep.
I mean, I talk to my students all the time, and I talk to to my patients about this all the time. I mean, if a patient comes to me and says, "Dr. Patino, I'm going to hurt you," my first question is, "Why are you telling me?" Right? Because if you're telling me that you want to hurt me, it's because you want something from me. You want to modify my behavior. You want me to be intimidated. You want me to not make a decision about something. Okay. So it becomes it becomes extremely important to understand that we have to identify what is the purpose of a behavior, right? So when you move that into toxic masculinity, you have to really get into understanding what is the purpose of you being aggressive? What is the purpose of you being removed? What is the purpose of you trying to impose your authority? Because it's the purpose that is important, right? It's not just the behavior itself. The behavior itself is something that becomes very evident, you know. You have this person who's self-centered, grandiose, boastful, using bad language or strong language, and trying to prove that he's the center of the universe, right? Underneath most of those people, there's a very empty and lonely person that can only satisfy some sense of value by attracting negative attention, right? I mean,
Like a little kid does when they want attention if they don't get it in a positive manner.
well, we're getting deep into personality disorders, but when you talk about personality issues like narcissistic, like borderline, like antisocial, which are the extreme personalities, they have a common denominator. They're all very childish.
Mm,
They'll tantrum, they'll project, they all self harm, right? And they have different variations on the personality, but at the end, these are intense people that underneath are scared and lonely. Let's leave alone the antisocial personality because that's very special in a lot of different ways. And we're talking about sociopaths and psychopaths. That's a little different, but they also have some degree of loneliness. But narcissistic people and people with borderline personality tend to manifest themselves in very toxic ways. So when it comes to men, right, we tend to see a lot of this childish tantruming, if you may, in order to impose authority or impose fear as the only way they know to manipulate or control other people.
mm. So you've mentioned in the past, and we just kind of touched on it about young people, adolescents, and that. And you mentioned even at one point that if you wanted to see toxic masculinity and action. Look at a bunch of young kids in high school today. Unfortunately, in Texas, a high school age kid, 18 years old, walked onto a campus and killed a bunch of people. Is there a connection with that, or is that a totally different impetus to do something like that nature?
Well, we cannot generalize in our business without understanding the movie, right? So, in order to understand why this 18-year-old who's now dead ended up walking into an elementary school and killing 14, 15 people and wounding a bunch of other people, we don't know what the purpose of that was. So, it can be, I mean, it's sad and it's intense and it's senseless, right? There's no way to justify what happened. In our business, in my business, we want to look at the movie. We want to see how you got from the time you were born to this point and what happened in three areas: biology, psychology, and sociology, right? So we want to understand the process. So an autopsy is going to be made of this. I know everybody wants to know, why did he do it? Well, that's that is not a question that is going to be answered in the short term, right? There's going to be a lot of distraction. What was the shooter's race, age, family condition? Apparently, he also killed his grandmother before he went to the school. So there's some details that we know, but we don't understand the inside purpose of that individual walking into a place with a gun, right? So we need to understand that if we are to be developing some prevention, like what happens with suicide, right? We have to do an autopsy of how men, in particular, and men that have toxic masculinity, that feel attacked, restrained, rejected by the world because masculinity is not acceptable anymore, let alone toxic masculinity. So we're pushing people into their bubble of loneliness and misery, right? And instead of extending a hand. So in my business, and this is going to be somewhat of a controversial statement because we hear a lot about suicide and homicide prevention, right? As far as I know, and as far as I'm concerned, because I worked with suicide and homicide prevention, quote unquote, for a long time, um, we have to remember that we're not preventing a lot, right? Statistically speaking, we don't prevent a lot of suicides. We identify people at risk, and that becomes important, okay? So, in my business, when a kid comes to the hospital and is with suicidal or homicidal behavior, because I see both, my job is not to prevent them from killing themselves or to prevent them from hurting other people. Is to identify how much of a risk they have and then figure out how we're going to decrease the risk, right? How do we decrease the risk biologically, psychologically, and socially? So preventing is somewhat of a misnomer, right? But that's true in most areas of medicine. Okay, we don't prevent diabetes, but we identify people at risk and try to do things so they don't become diabetic, right? Same with heart disease and lung cancer and most of the things in medicine. We don't do a lot of preventing, but we do a lot of risk determination, right? So if you go to an ICU with a heart attack and you ask the doctor, am I going to have another heart attack? The doctor's probably going to tell you, I don't know, but you're at risk because you're obese, you're hypertensive, you're drinking too much, you smoke too much. So if you want to reduce your risk, these are the things that need to happen. Unfortunately, in society in general, we always want to have a cause and effect, right? So we want to have a recipe for prevention. If you do A, B, C, and D, if you put 5 police officers in every elementary school, you're going to prevent this from happening. That's not a recipe because it's not based on identifying individuals, right? A show of force is not going to prevent this from happening. I mean, you could have had 2 police officers and he could have killed 2 police officers, right? So So we have to understand and identify people at risk of these behaviors, which is what I do every day, and then develop a treatment plan to reduce the risk of those things happening. But we cannot reduce the risk down to zero,
Mhm.
right? And that's where people get really frustrated because parents come to me and all the time and they ask me, is my child going to commit suicide? And I said, well, I don't know. But I can tell you, your child is a risk because you have this dysfunction in the family, there's domestic violence, one of the parents has a substance abuse issue, the kid has a lot of abandonment issues, there's a history in the family of depression and anxiety. All of these things need to be looked into. So you start to understand that managing risk is not elegant, is not fancy, is not popular, and worst of all, nobody makes money out of it.
No, yes, absolutely. In my other job, it's the same thing. Nobody wants to hear about avoidance. They want to hear about what do you do when the incident occurs. Back to a point that you made. You talk about the risk factors. So somebody out there is listening to our show. They have a husband and a friend, a boyfriend, a brother, or whomever, who is manifesting some toxic behaviors. What would be or what are the greatest signs for someone to see of someone at risk? I mean, you see it every day. That's your job, and most of us are not trained to the level that you are. What would you tell people out there to look for in order to understand if a person is at risk, particularly a male in their family or their workplace?
Well, you have to look at their behavior, but not one behavior, right? One behavior does not make a risk. A pattern of behavior makes a risk. So we have to pay attention, right? Do we have to pay attention to where does the individual come from? What kind of background they have? Do they have a family history of violence? Has the child been abandoned? Okay, have the does the kid has manifested issues of aggression in the past, right? I mean, not necessarily going to grab a gun and shooting people, but is this kid a bully or is this kid being bullied, right? So all of those little details have to lead to somebody raising the question, I'm concerned about this kid. Not to ask the question, is this kid gonna kill someone? That's a wrong question to ask. The question you need to ask is there something risky about this individual, both in terms of mental illness, danger to self, danger to others, right? I mean, there's certain behaviors. We see this repetitive pattern of behaviors, right? I mean, I have 3 kids in the hospital today who want to kill their families, right?
Mm,
And some of them have acted out in violent ways. So when they get to me, they're getting because there's a crisis, they're getting into an inpatient setting. So now my job is to kind of build the movie somewhat so I can understand how do we prevent this from happening? Is there an opportunity for reunification with the family? How does the family feel about having someone who wants to kill them? Right? There are a lot of issues that need to be dealt with that require a team of people, right, to work together with a goal. And we don't have the resources to do it right now. I work in mental health. Think about the school system, right, that now is being concerned about all kinds of things that have nothing to do with preventing any of this,
mm,
right? I mean, we are having now the parents behaving like the kids, right, and having tantrums and fighting with each other, forgetting what the purpose of education is. It's about the kids, it's not about the parents. And if you continue doing this to your kids, the kids have a higher risk of being toxic, right? Because the kids are very malleable. The kids can learn from other people. So it's very important that we understand the number one rule that I tell my students all the time, it is never about us. Is never about my beliefs, is never about my judgment, is never about anything that has to do with me, religion, politics, anything like that. Is you always have to ask the question in the sense of what is in the best interest of the child? How can we help this child have a less destructive future? toward themselves and other people. Now, you need to understand a lot of these kids have already gone through a lot of trauma, abandonment, abuse. I mean, we have kids in the hospital that have one of the parents have died. The kids are in cages for a couple of years, six of them. I mean, fortunately, that was taken care of. But now the kid gets to us, and the kid has a lot of issues, right? How do we go about these? Are the extreme situations. So we need to look at what are the risk factors that the school needs to be identifying, and people need to stop being distracted with minutia, right? Like who goes to the bathroom, gender issues,
Yeah.
political issues, Disney. I mean, come on, can we all at least get focused on what's important, which is that the kids get educated and that nobody kills them?
Yeah, I couldn't agree with you more. I personally wouldn't care if a person identifies themselves as a four slice toaster, as long as they don't hurt people or benefit the society. I think you're right. It's ridiculous. So you're talking about children because, of course, that's what you do. But let's say somebody my age, 50 some years old, or someone in their 30s. What are the warning signs for somebody who is seems very macho and very tough, but really because of that is at risk of suicide?
One of the major things we need to understand that just by being male, you have a higher risk for suicide. I mean, 7 out of 10 suicides are males, only three of them are females. Second thing is that we have to maintain contact with people. Isolation is one of the worst situations for people that are lonely, right? Because then they just keep stewing into their own badness, their own loneliness, and their inability to sense any sense of value, right? And veterans in particular are very vulnerable to that because veterans are the one of the main groups of people that we tend to ignore. Okay, instead of praising them, I mean, we have a professional military in this country, right? These people get paid, and we end up believing that because they get paid, we owe them nothing, right? And that is wrong. That is very wrong. We have to extend our hand. A lot of these people end up lonely in the streets, right? Now, those that actually have loneliness, isolation, which is kind of the article that we looked at,
Hmm.
loneliness, isolation, reclusive, and then you start adding substance abuse, okay, drug abuse, and the availability of firearms, right? Then it makes it kind of a toxic mixture, right? I mean, these are people that are not going to go and tell someone, I feel suicidal. They're going to grab a gun and they're going to blow their brains out, right? And that's usually how it happens. So we had to be vigilant. And I mean, I have to praise the therapist, for example, in this article that is described. He's visiting people. He's not visiting just to have a therapeutic session with them. He's just visiting with them so they understand they're not alone. I mean, most men that come to talk to me because of psychiatric issues or depression, anxiety, domestic violence, whatever their motivation is, which is usually borrowed, they don't come to me because they want to come to me, right? But when they come to me, it is obvious that all they want to do is to have somebody listen to them and to understand that their loneliness, their feelings of emptiness, their low self esteem is real. It's not that they're being weak, it's not that they're being subhuman. It's real. That's how they feel, but they don't know how to. And just by listening and opening the door and validating that they feel those things could be an opportunity to save a life, right?
So you again, you're trained to do this. You do this for a living. I'm sitting across from a friend of mine who I maybe think has some issues going on. As a layman with no experience and no training in this, what are the type of questions or what are the statements maybe that we need to be putting out there in order to hopefully engage them and be some type of help, even if just a visitor, like you said. We're not going to be a therapist, obviously. What would you tell the layman to ask to say?
You know, more than what you say is how you listen.
Hmm.
You see, if a man comes to you and has enough trust in you to let you see a little bit of their suffering. I mean, if they come to you and they say, I got me feeling pretty tired lately. Uh, you know, I can't stand my wife. It's getting to me. If somebody has enough confidence and trust to tell you that, the worst thing you can do is to make a judgment. I mean, you don't want to say, "Oh, come on, how can you feel that way?" You're tough, Mister Macho. You are. If you do that, that person is going to shut down because it's searching for an opportunity to somebody to listen. So if somebody comes to me like that, even though I'm prepared for that and I'm educated to do that, and I'm trained to listening empathically, I would just basically say something very simple. Uh, Guys, that must be hard to be said. It must be hard for you to say what you're saying. How do you want me to help?
Hmm.
I mean, it's just the understanding that you're there to not make a judgment. You see, people who are toxic in their masculinity have a lot of difficulty with other people judging them because they're doing pretty severe judging of themselves. So they don't want to present to you as being weak, right? So listening more than talking becomes terribly important. Okay. And you just have to they have to know that you're listening. You can't be on your phone and they're talking to you and you're ignoring them. You know, when you have friends sit next to each other and they talk. They don't send messages on their phone.
Uh-huh.
They talk and they expect you to listen. That's what friends are for, to listen to each other, not to tell you what to do. Most people will never come to me for me to tell them what to do. Actually, I don't think that medicine should be about telling people what to do. I think that medicine and psychiatry is about giving people options that they can freely exercise, right? So I'm not going to tell someone, oh, you have to go and tell your wife this, or you have to go home, you have to stop drinking, right? How many times have they heard that? You know, I mean, I need to understand how can I extend the hand so this person in front of me feels comfortable enough to take the risk of letting go of the only tool they have to cope: drinking, drugs, violence. What can I give you so you can have other choices, right? So my job is not to give him answers or to solve their problem, is to give him options. So you have somebody who's toxically masculine, you have to identify it, and the worst thing you can do is to reject them. Okay? I
Really,
mean,
give them a safe place to share.
exactly. Exactly. And we all have places like that. You have people that cope with their issues by going to the gym and chatting with somebody there, right? We all have skills that we have developed. When things get toxic, the only thing you're going to hear is rejection.
Hmm.
It's that you are bad, you are toxic, you don't know anything about how to deal with masculinity in a healthy way. So what do? They just get worse, right? Because you're not giving them a space where they can say, you know, sometimes I feel weak. Sometimes I feel lonely. Sometimes I feel sad, right? Sometimes I feel like crying and I don't want anybody to see me doing that, right? Because we carry so much baggage about masculinity that we have evolved with, right, over centuries in our own genetic, psychological, social development, that use the idea of showing weakness is worse than being castrated.
Hmm.
right? And I have to say, I don't like to use that phrase too much about being castrated because that's toxic in itself, right? Is to think that we are better because we have testicles. No, no, no. It's not along those lines. It's just the idea that men feels castrated and identifies testicles as the source of masculinity because that's where testosterone comes from, blah, blah, blah. Anyhow, so we need to understand that we need to provide a space for people, and we need to recognize that when people are lonely, just because of the fact of being men and being lonely, makes them a risk for suicide,
Hmm.
right? Now you have to understand that, especially with older men. Let me just finish by saying this: older men, especially older men who are married, when they lose their wives, right, they will kill themselves at a very high rate. Okay, and it's fascinating how man has difficulty living without their wives. This is kind of paradoxical, but females don't kill themselves after they lose their husbands, but men do,
Is it
right?
because they've lost that one person with whom they could be open with?
Yes, and most of the time, and when I give talks to family doctors, I always say, listen, if a gentleman in their late 70s, mid 80s comes to you after they lost their wife and they look great, right? Be concerned
Hmm.
because they're coming to you to say goodbye, right? And they're going to go
Wow.
home and they're going to kill themselves. So in that person, you're not going to see depression. I mean, they actually feel liberated, right? And they feel that they have a choice to not being there. Right now, I'm not saying that that's correct, but what I'm saying is we have to be able to identify, and sometimes the presentation is quite paradoxical. Men, in particular, start giving things away, right? I
Hmm.
mean, if a friend of yours comes to you and say, um, Vince, these are the best guns I have. I want you to have them. Be concerned,
Wow.
right? Those things are worrisome.
So really, for the rest of us out there, if someone is acting out in that way, instead of trying to respond to it negatively or fight them on it, be aware that it may be coming from a place of pain, a place of loneliness, a place of suffering, and try, as tough as it can be, have a little empathy, extend the hand, extend a verbal invitation to allow them to speak to you with some safety, and hopefully, and who knows, maybe even save a life that way.
Well, not only save a life, but identify somebody who's at risk and eventually maybe guide him into the right place.
Even better. Once
Hey,
again, doctor, thank you very much
thank
for your
you.
time and your information. Have a great one.
We'll talk to you later. Thank you.